there is a big things for us in our society, at least, we should still learn and include. And Kuuli Lukk is a National Institute for Health Development, and she is for Department of Community and Workspace, the senior specialist, and she's our good northern neighbor from Estonia. We used to live in one country a few centuries ago. So we decided that each of the panelists will have 3 or maybe 3.5 minutes, and probably 1 or 2 or 3 slides for presenting, let's say, 3 key questions. So what about these your country health prevention programs? How do they include physiotherapists? How much of funding is actually allocated? Because in a case of Latvia, for example, we even managed to allocate some European money of regional development funds into these health programs that are realized by local communities, by municipalities. And then the third question would be, how do institutions ensure the implementation of the health promotion programs in your country? Is it regional? Is it national? Does it exist at all in a whole society? So hopefully this now gives us a good real case scenarios. And then on the basis of this, we can continue with a bigger debate. So I think it's fair enough. And let us then start with Esther-Mary from Ireland, but of course, talking probably on a European level yourself as well. Please, Esther. We see your presentation. Thank you. But we don't hear you yet.
Okay. Can you hear me now?
Yes, very well. Thank you. So please.
Thank you very much. Thank you, Ansias, and thank you for the introduction. I'm looking forward very much to this. I just need to put my bias out there first. My background is in health promotion. I did my master's in health promotion a few decades ago. I felt that it was just so akin to physiotherapy and to everything that we did, that it was really the way to go. So I come from Ireland. I used to watch people sending up these beautifully exotic slides of where they came from, and I thought, well, I live in a pretty exotic place as well. So I live on the Atlantic coast. I swim in the Atlantic every day, 8 degrees at the moment. So yeah. Now let's see if we can. Oh, sorry, this is not working for me. Okay, so both Tim and I suppose, will be coming from a slightly different perspective, in that we'll be giving maybe a little bit more of the background as well as the country, and Tim will be giving the European perspective as he chairs the European Working Group. I just wanted to, I suppose, just mention a few things, and thankfully they came up yesterday as well. I think as physiotherapists, we're big into educating our patients, but I think the big message has been with health promotion is that education doesn't bring about behavior change in the same way of that knowledge to action gap, and that was also mentioned yesterday as well. So the difference is health promotion, and it's about empowering and participating. And if it's not there, it's not health promotion. And my warning for physiotherapists, I meet lots of people say, oh, I work in health promotion, I run back classes, that's not health promotion. Unless you're empowering the patient and the patient is participating, it's not health promotion. So I'm starting with perhaps a negative wing, but I don't mean that. Reminding us that we are guided by the Ottawa Charter with regard to health promotion. It is a fabulous document, and after all these years, it remains the gold standard work that determines health promotion. And these are the principles. And again, from a physiotherapy point of view, I'm picking out this empowerment and participation, working on an individual basis. So in my country, we are guided by a few documents, including, for instance, this wonderful document from the WHO on physical activity. And then in Ireland, within the Department of Health, we have a Department of Health Promotion, and in terms of kind of promotional material alone, it spends about 5 million per annum. We have 2 documents that are our guiding documents: the National Framework for Improved Health and Wellbeing and Healthy Ireland. And this piece from the WHO is one I often use, and I think it's so important with regard to health promotion, about treatment not just simply being a technology, but so much of it depends on our own skills and the attitudes of us who apply it, as well, obviously, as the disease and the other characteristics. So in Ireland, we have a total national public sectoral approach, and we have had for many, many years. And this means that everyone working in the health sector, in the national health sector in Ireland, needs to use their contact with the patient to work in a health promotional way. So it started off by being these, what used to be called brief intervention skills. So during your assessment of the patient, you would inquire, of course, in our case, about perhaps their physical activity levels. And this was obviously done in that, as I say, empowerment approach. It wasn't interrogatory, it wasn't lecturing, it wasn't educational, it was about inquiring. It then moved on to motivational interview, where not only were we sort of asking and doing a little bit of searching, but we were also motivating the person. And now we work on this basis of what's called make every contact count. And this is just coincidentally is used in the UK as well. In terms of what the physiotherapy aspect of it, I think that we know by and large, unless you have a highly motivated, like athlete type patient, that home exercises by and large don't work unless you have a health promotional aspect into it. The whole approach is a client-centered care approach. It's about a partnership with the patient. It's not that parent-child relationship, but we are working out the goals with the patient, because often the patient's goals are different from ours. And we're the expert in the treatment, but we're the partner in the process. And we identify priorities from the patient's perspective. And we also identify cues and barriers, particularly the barriers. You know, we're great at saying, you know, do this exercise X times a day, but really we need to sort of find out when it is suitable for the patient to do it, and that increases the uptake. So that's about empowering. As I said, there's different levels of motivation. I'm putting in a plea here. I say to my students that I never, ever, ever, ever want to see on a physiotherapist notes non-compliance. If there's an issue with non-compliance, the issue is with the physiotherapist and not with the patient. We use the stages of change. I'm not going to go through this in detail, but there's a plethora of health promotion, health psychology models and frameworks, but sometimes it's really good when you're talking to the patient how to find out where they are. Are they thinking about taking up more activity? Are they not thinking about it at all? And this model shows that people will take up action, they'll maintain it, but they may fall back. And to get true behavior change, you're talking about 5 years. Just lots of words here. I'm not going to go into all of them. They're all very, I think, self-explanatory, but this is the kind of approach that we use in physiotherapy and health promotion. This is where we work under the kind of the great health promoting the settings in health promotion are the greatest part of the Ottawa Charter. And so we work in workplaces, cities, health promoting hospitals, and schools. I'm particularly interested in the work in schools, because that's setting it for the lifetime. When they evaluated the Make Every Contact Count in Ireland, physiotherapists were actually to the fore, and there was the highest proportion of interventions in all age groups than any other health professional. So we are really in there in this. Just a quick one on the CSP. The CSP in the UK, separate from Ireland, is also as an organization is very to the fore at putting physiotherapists first in the health promotion sphere. And many of you may have seen their love activity, hate exercise things. So they're acknowledging that people do have a love-hate relationship with physical activity and exercise. And again, using Make Every Contact Count, they're empowering their patients to take up activity. And lastly, I just want to show you some things that we use. This Move for Health on the left-hand side, we see lots of the the food pyramids, but we have developed the exercise pyramids. We're going to have to change them a little bit now with the new WHO activity guidelines, which came out last week. But just to show you the ones that are used for children, and just to remind you, if you have an animal, that's your kind of personal trainer, and that using the stairs instead of the lift is a great free exercise machine. I raced through that. I hope it was okay. I normally speak very slowly, but time is of the essence. So thank you very much. I'm delighted to be part of this.
Sorry, that's my fault. Thank you very much. Actually, great to have so many promotion materials as well. I think this is also one of the ideas we can always copy paste as ideas, but realize on our own. And this will be still realized by us and dedicated to local needs and realities. So Tim, Esther-Mary promised that you will now speak on a European level. So we want to see what kind of differences there are. What is the temperature in your swimming pool of this morning, Tim?
Good morning. Well, I'm Tim, I'm from Belgium, and unfortunately I don't have a swimming pool. I don't live by the ocean. I just took a hot shower, so that was about 30 degrees.
Okay.
Luxury.
Good. Different strategies, huh?
Yeah.
So what about European level when you look from Ghent, from the very almost north of your country? Huh?
Well, I'm actually not from Ghent. That's Jan. I'm from the east part.
Sorry.
But Belgium is
right. But still next to the northern sea. Huh?
I'm going to ask Liva to share the screen because she has my presentation. Okay, Liva, you can quickly go to the third slide already because I've already been introduced. I'm not going to talk about Belgium. I'm going to talk about the European perspective as I am on the executive committee. And Liva just asked me to be very brief and go very quickly over all the initiatives from the European Union, the WHO, in perspective to what we do as a European region of the World Physiotherapy Association. So I gave a brief overview, or I will provide you with a presentation with all the initiatives that are available. And I'm not going to read them out loud. The presentation will be available. So I'm just going to briefly highlight that for the European Union, there are some initiatives like the physical activity guidelines. There's the Health at Work, the Horizon 2020, and especially with the 6 formal societal challenges where we participate. You have the European Core Health Indicators, you have the EU Health Policy Platform, and I just took them in the presentation so that you know that the European region, the Physiotherapy Association, is involved in all of these initiatives, or we participate or we are actively involved. So if you need advocacy material or you need some background information like you just highlighted, you can always contact us and we will be more than happy to provide you with material we have or with the collaboration we already established. So Liva, please, the next slide. You all know the WH Europe, and you know the physical activity fact sheets, which are available for 28 member states. The physical activity strategy from 2016-2025. There is also the report of the 10th meeting of the EU physical activity focal point. And what's perhaps interesting for you, if you want to travel a bit more south and to the sun, in September next year, if everything is going all right with the COVID and the vaccinations, there is a conference from HEPA, and it will be held in Nice in France on health enhancing physical activity. So perhaps we can all meet there and continue this conference on a physical basis. Liva, next slide, please. The other thing from WHO, and you all know that the physical activity guidelines, the new, were just published. So if you don't have access or you don't know the link, please ask and we will provide you with the link. I'm talking very fast because I don't want to use up my 3 minutes, and I want to give the other participants the opportunity to talk. So please, Liva, go to the next slide. And this is actually the most important one. So like I said, we as the European region, we participate, and we actively participate or are involved in many of the initiatives that you saw in the previous slides. And I just highlighted 2 things that to us and to your conference are very important. And that's we are actively involved in the EU platform for action on diet, physical activity and health. And there we have the promoting physical activity in children. We have a paper published on the role of physiotherapists. And we also have a briefing paper on active and healthy, the role of the physiotherapist in physical activity. So these are all available. These are all available online through our website. So in order for you to be more active or to see what is already done, you can easily access these documents. And the last slide, please, Liva. We also have a big campaign with the European region for branding physiotherapy as it is. And we have 2 main branding types, and that's the Think Physiotherapy and Physiotherapy Moves. And also on the website, we have a lot of fact sheets covering a lot of topics. So you can also go there and see whatever helps you in advocating for physical activity and see what you can use to get the people more involved and to make sure that you do reach the goals that you set out. So apologies for my very quick talking, but this is kind of my presentation, and I would be more than happy to answer more questions in detail later on. Thank you.
Yes, exactly. Let's do it. Let's do the quick overview, and then there will be questions, I'm sure. So let's go now to Brussels still. I understand that Katarzyna Glowacka-Rochebonne, she works as actually the program manager for Poland, but that gives her the good overview also that you can probably share to us, Katarzyna, please, from the perspective of DG for regional and urban policy. So first and surprising question to me would be, is it really governed and even paid by DG region, not DG health? So the health promotion itself is kind of under a different ministry, one might say, than usually we should suspect. So please explain this logic and philosophy as well, please.
Okay, thank you very much. First of all, thank you very much for inviting me. It's an honor for me to be at your Congress. And I will ask also Liva for help, because recently we had some technical issues, so I don't dare to share my screen anymore. And I'm sorry, I will have to ask you to change slides. I prefer to do it myself, but okay.
That's okay. I will try. Is this?
No, this is not this one. This is Jan. Mm-hmm.
And this is not the same, right?
No.
Sorry, I will do it. Then can I ask it to do it yourself, because it's not in my email then? It will be very easy. You try, find this green share screen. Or just quickly send it to my email.
Yeah, okay, I can do the share screen. Mm-hmm.
Yes, choose the presentation.
Mm-hmm.
Yeah, push.
Yeah, it is.
Perfect.
Okay,
Thank
great.
you so much.
Just large it for whole screen and we will see.
Yes,
great.
And
so
how about the sound? Because this was problematic last time.
It's very good.
Okay, great. So I can do it myself. Great.
Yeah.
It's even better. Okay, so maybe I will explain this structure, DG Regio, Santa, etc. at the end, because it will fit well with my last slide. And here I will just start presenting. I have a couple of slides, but I will try to be brief, because in fact my slides are only to illustrate, I would say, 3 main messages for today. First one is that there is a budget, hopefully it will be approved. There is budget for the EU, a very big budget, and there is health in this budget. Second message is that the scope of your work, the topic of today's Congress, you as health workforce are among priorities in this health budget. And a third message is about partnership, that you should be and hopefully will be partners in programming, implementation and monitoring of these funds. So let me start with this first aspect. This is a historic budget, the biggest ever. It exceeds 1.8 trillion euro. I cannot even imagine this figure. So the ordinary multi-annual financial framework of 7 years has been combined with additional money for the next 3 years, the so-called Next Generation EU, which is supposed to help to recover in the times of pandemics. In this huge budget, several instruments are hidden. Some were mentioned by Tim. It is not possible to go into details, but some of them are managed by DG Sante, some by DG Regio. And I will focus on those that are in my portfolio and that are, I think, among the most interesting for you as well. That is REACT-EU and the cohesion policy. I wanted to give you some interesting information, so I put the allocations for next year because this has been already decided, of course, under the caveat that it is all approved, the whole budget. And the REACT-EU, as I said, is a temporary recovery instrument that is not only for health, obviously. A big part of the budget in general is supposed to tackle the climate issues. 30% of the budget is for the climate, but health is there. And some members, it's up to the member state to decide how much will go to help in recovery of the healthcare system. This REACT-EU will be implemented via 2 funds, European Regional Development Fund and European Social Fund. And the focus of this investment should be on rebuilding the so-called resilience of healthcare system. Now, the key question is, what is a resilient health system? It can mean different things for different countries, but in general, part of the resilient health system is strong primary care, it's disease prevention, and it's sufficient number of sufficiently educated healthcare personnel. As for the cohesion policy funds, programmed for 7 years, the perspective is a bit longer. So here we should focus on longer term objectives of recovery, but also investing reforms, the transformation of healthcare system. And health is among different boxes here, different policy objectives, but mainly under the yellow one, which is supposed to implement the European Pillar of Social Rights. And where is health here? Well, similarly to REACT-EU, it's about resilience, it's about access to healthcare services, it's about sustainable services. So this is like the framework for the investments. Now, the second part of my presentation is now, how do we define more precisely the priorities? What does this mean for particular member states? Well, I put at the bottom of the slide this information for you to explore more if you are interested. But for the Commission, the starting point in defining priorities for investments are the so-called country reports that are issued every year within the European semester process, and the specific recommendations issued for each member state. I copied here parts of these specific recommendations, the main concerns that we see in the 4 member states that are that are of key interest for today's Congress. I think we share similar concerns, especially when it comes to the healthcare staff, but also strong primary care, which is underdeveloped. The systems focus too much on hospitals. This is why in the recommendations, we say, I mean, Commission makes a proposal and then Council approves. So these are valuable recommendations that the member states should focus on addressing these shortages, on improving, strengthening primary care, on shifting care from hospital level to lower levels of care. And then in the country report from last year, we translated this, we as Commission translated it into investment proposals, how to invest concretely funds in health. As you will see, it is all about strengthening workforce, strengthening disease prevention, reskilling, upskilling of doctors, measures to increase healthy life years, addressing healthy lifestyle risks. Yeah, I invite you to have a look at the documents if you want to have more. These are reports from last year, but they are still valid. These challenges did not change. So now my last slide and the third message to you on partnership. How does this work in practice? Well, first, as I said, at EU level, the first box, we in the Commission identify priorities on the basis of regulations and present it to the member states. Now we are more or less slowly in the second box. So member states at their level, governments and regional authorities prepare programming documents. So first of all, partnership agreements, which are kind of umbrella document on where each member state wants to invest funds. And then it is presented in more detail in the programs, concrete programs that are subject of negotiations. This will happen next year. Hopefully by the end of next year, the programs should be ready. And then they are signed by the member states and European Commission and then implemented. The institutions responsible for this are managing authorities, and you have linked to them in the last box. And here I want to draw your attention to the European Code of Conduct on Partnership, which is binding in this programming perspectives and will be still binding in the future. In fact, the regulation on funds explicitly mentions obligation of member states to involve partners in preparation of these programming documents and not only consult them on the ready drafts, but to involve them in the design of these programs. This is already binding now, but feedback from stakeholders and partners shows that this is not always working. It depends on cultural and national differences. So it is not always very easy. This is why we always appeal to stakeholders and partners to be active by yourself, go to local, regional, national authorities, actively ask. In some cases, the information is very transparent, it's all public, and stakeholders are involved. In some, it requires a bit more effort, but it is worth this effort. And I wish you all, those who are going to implement EU funds, good contacts with authorities and successful results. Thank you very much.
Oh, thank you, of course, and we will talk about the results a little bit later. Thank you very much, Katarzyna, but let me now check amongst our speakers that we see online. Jan, the Maeseneer, maybe he's hiding with a different identity, no? He's not, so he's not here. So hopefully he's well and will be coming in the picture later. But now we move to Dalia Woznica. She is from Poland, a real physiotherapist, isn't it? So now let us see it from the eyes of professional Dalia. So how do you see? Maybe can I address you already a direct question? Do you see that your role is actually becoming more and more important? And are you not let's say you want to be part of this new program of programming period of 6 or 7 years, which were presented by Katarzyna, but in the same time, you are too late. Programs are already drafted and they will be signed in few moments. So the money is kind of allocated and decided. So maybe, sorry, next 6 years, then you will be real active in real life. So how it looks from your side? Yes, Dalia, please.
Yes.
No, we hear you. Yes.
I'm here. Just shortly connections problems, but I'm here. Well, I will show you in my presentation that yes, physiotherapy is also a good key to health promotions and health preventions. But I will not talk a lot about financing, so sorry. Let me, Liva, can you put the presentation of mine?
Yes.
Thanks.
Yeah, I think we're ready. Can we?
Thank you. So good morning. Can you go straight to the first slide, please? Yes, so to outline a basic view on health promotion in Poland or health prevention programs in Poland, you need to be aware we had 3 different types, and depending on the provider. When a supplier is the Ministry of Health, programs are specialized, dedicated to ministerial needs, and you can see the examples below. When National Health Fund is a provider, programs are funded from the public sector. They are delivered by the institutions contracted with National Health Fund, and they are basically the same, as you can see below, the examples of those preventive programs. Next, please. Now, let's focus on local governmental actions. We have nearly 3,000 local institutions in Poland. Each of them could provide public health programs, either from their budget or European budget. In reality, and we based on the Supreme Audit Office, only 20–25% of those local governments deliver regional health promotion programs or prevention programs. And as you can see, during 10 years almost, we had almost 3,000 health preventing programs reviewed by the National Health Technical Agency. This is the agency which is responsible for creating and reviewing such health programs in Poland. And mostly they considered vaccination, but also they included rehabilitation. Next, please, slide. Okay, I will talk a little bit about financing. Well, analyzing allocated fundings in 2020 in Poland, we see that the National Health Fund expenditures on health prevention programs reached over 60 million euro. From the public health expenditures in the national health programs, local governments spend yearly almost 700 millions, but on the health actions in total. The exact calculations regarding health promotion programs varies between 25 or 100 million euros based on the different expertises. Next, please. But let's focus on ensuring and enhancing health promotion programs implementation into a system. We could divide it into a regulative and innovative approach. In Poland, those programs implementations has its obligatory frames. They are based on an act on the healthcare services financed from public funds. They are also based on guidelines created by the National Health Technology Agency, which I mentioned earlier. And of course, each implementation of those programs outcomes should be reported. But from the innovative approach, it should include involving different professions, not only in providing health preventive programs, but also when creating them. Small local entrepreneurs should be taken into account. all effort is really to aim exact social needs of those programs. And we also have a digital reporting system. I mean, it will be available in Poland. It's called ProfiBase, hopefully next year. It is an application co-financed by the European Union, and it will monitor all health programs implemented nationwide and thus enable effective action planning. And of course, thinking about future, we know when it turns to COVID that it's first focusing not only on primary prevention, such as vaccination, but also secondary prevention when it comes to deal with COVID survivors and their post-disease complications. So contribution of physiotherapists really arose in the matter. And of course, new sources of financing. This is always a hot topic. In Poland, for example, local governments plan to use part of alcohol local tax money to cover COVID-related health needs. This is based on Anti-COVID Act, which is recently implemented in Poland. So those are money which could also be used to present health promotion programs. Okay, next slide, please. And this is my last slide. It presents examples of health promotion programs, health prevention programs, cooperated by our Polish Chamber of Physiotherapists, and included physiotherapists as creators of those programs, but also providers. And these are, for example, post-COVID rehabilitation. We collaborated together with WHO, newborns assessment, early scoliosis diagnosis, and of course, elderly fall prevention. Those are the most common health promotions among physiotherapists. But we also launched programs like Active Senior at Home and Active Break at Home. Thank you.
Just to be clear, you mentioned a very special program now, post-COVID-19 program. So whom it should be dedicated? You always have limited number of resources of physiotherapists and so on. Do you talk about like physiotherapist role in this, let's say, prevention of a mental health problems or obesity, or what you're talking about? This is very specific and should be probably started just now. So whom to address at first?
Yes, the most common promotion topics among physiotherapists, this is obesity, of course, the physical activity increasing. When it turns to COVID, pulmonary physiotherapy is important, elderly, fall prevention of elderlies, children body postures. So these are the most important issues when we physiotherapists could participate in the health prevention.
Okay, Dalia, so congratulations. Definitely you will have more and more job to do in the future. So hopefully more and more money will arrive as well. that's kind of reality we can predict with no rocket science involved. So now let's go to Thierry, Franke, and I promised to Jan that we will come back to you, but I want to warm you into our discussion. So Thierry, please, now the real look from Dutch perspective, how does this works, and how old is your tradition? We have this feeling that your tradition is the best one in Europe. So please now reassure us that we are right. Sorry, Thierry, you have to put the mic on, and then we hear you. Not yet. Somehow we don't hear you. And now? Uh-oh. What to do?
Can you hear me now?
Ah, yes, now it is. So welcome. Now we hear you.
Yeah, wrong settings on the mic in Zoom. So thank you for the introduction, Ansis. And I don't know if the Dutch way is the best or the oldest in Europe. I'm not really sure. But we try and do our best. And I'd love to share with you an example of a health prevention program that we have in the Netherlands since 2019, a combined lifestyle intervention. And I'll show you some highlights of what we've been working on, what physiotherapists have been working on in the Netherlands. I hope you can see my slides. Everything's good? Yeah, okay.
Not yet, maybe
Not
do
yet.
one.
Okay, wait, let me try again. Now, wait, share, yes. Okay,
yes,
great. Now I can see my slides, great. So as I said, I was going to talk about the combined lifestyle intervention in the Netherlands. It's a specific health prevention program in which physiotherapists, among other professionals, play a role in the Netherlands. And well, it's been developed because of the rising trend in overweight and obesity in the Netherlands. For years and years, the number of citizens with overweight and obesity has been rising, up to about 50% of the people in the Netherlands right now. And the government has made it one of their goals to turn that trend, as it were. So in order to do that, they have, with about 70 organizations, made the National Prevention Agreement, which is an extensive agreement with 3 broad topics: cessation of smoking, reduced alcohol consumption, and battling overweight and obesity. And as part of this agreement, the combined lifestyle intervention has become part of the Healthcare Insurance Act per 1119, which means that the combined lifestyle interventions are available for every Dutch citizen as basic healthcare. They're available for all adults, and you need qualified and licensed professionals to provide the combined lifestyle interventions. And I'll talk briefly about what they are. So a combined lifestyle intervention is an intervention which combines 3 important parts. It's always those 3 parts. It focuses on a healthy dietary intake, regular physical activity, and sustaining that behavior, so changes in behavioral patterns. You need to get the behavior change for people to get motivated and to keep up the proper habits, as it were. Oh, that's a bit too brief, a bit too fast. So as I said, the inclusion criteria, it's for people with overweight and obesity. If you have a body mass index higher than 25 and one of the listed comorbidities, you meet the inclusion criteria for a CLI or a body mass index higher than equal or higher than 30. And the combined lifestyle intervention, as you already saw on the next slide, is part of a stepped care strategy which we have in the Netherlands. And it's actually one of the first steps in the healthcare system to offer the citizen something for overweight and obesity. After that, you finally end up with a surgical intervention if all the previous steps in the strategy fail or do not succeed sufficiently. So those programs, the combined lifestyle interventions, there are 4 different programs. You see the logos here on the screen. It's called the Beweegkuur, Slimmer, Samen Sportieve Beweging, and Cool, and that's all Dutch. So I don't know if any of you understood it. Probably Tim, he's from Belgium, but for the rest, it's the names of the programs, and they all look similar in the sense that they all take 2 years. They all start with a referral from the general physician, then an intake with the lifestyle coach or the physical therapist lifestyle coach, as it were. And then you have a treatment phase in the first year, and then you have a maintenance phase to prove the behavior changes, as it were, in the second year, and then you have an evaluation at the end of those 2 years. And during the entire programs, well, from the 4 programs, some are multidisciplinary in nature. So you always need a dietitian, a physical therapist, a lifestyle coach to perform them. And one of the programs is monodisciplinary in the way that one professional combines all that knowledge and skills and provides the entire program to a group of patients. And as the professional association of physical therapists in the Netherlands, what we do is that we try to enable our members to perform the CLIs, the combined lifestyle interventions. So we facilitate trainers to provide quality education for them so that they know what to do within those programs, that they have the right set of skills and knowledge. We develop a policy to facilitate professional development for those lifestyle coaches. We advocate for their socioeconomics interest for the implementation of the combined lifestyle intervention, and we support local providers. That's briefly what we do. And our perspective and short-term goals in the Netherlands are that we want to further the implementation. What you see here is a chart of our tiny country, but even within the tiny country, there are not yet enough providers. As of right now, there are about 1,000 providers from different backgrounds. About 400 of them are physical therapists, but it's not enough yet. We don't have coverage throughout the country, so not every citizen has access to this basic type of healthcare. And further, we want to develop the Combined Lifestyle Intervention Plus, which is the second step in the step care strategy for people which need a more intensive combined lifestyle intervention, for which the original combined lifestyle intervention is not sufficient. And the long-term goal within the National Prevention Agreement and for us is to turn the trend, which I showed you in the first slide, the graph. We want to turn the trend of the rising overweight and obesity and even hope to get a decrease by 2040. That was my presentation.
Yes, thank you very, very much. I think it just shows the difference. We are hoping for kind of extra funds from the government or European Union. Your system is already partly covered by a health insurance system that, of course, has its traditions as well, and this is just makes this beauty of Europe, which is united in difference still. Huh? Even in these terms, there are so huge differences that sometimes unification is not an easy task at all. So we will try to see. Now let's see a Latvian perspective, and this is really thank you to Maija Pauniņa. She actually works for a Center for Disease Prevention and Control of the Health, and all Latvian society definitely hopes that they are not overdoing their real life attitude, because this is a center which in a small and compact country like Latvia, they very much care about the real numbers, the real passages of the COVID, how to prevent and how to suggest the best decisions by the government. So thank you, Maija, actually being here, because I know how busy you in your agency are today. So thanks again. So thank you for thinking forward, and actually thank you also for Esther-Mary. Your comment is just in time, because I think we just will see a lot of things to do for you professionals here in this post-COVID reality in the continent. This will be definitely your special time of your profession, needed, but also probably in a great deficit so thank you for those who are also good professors and training more and more real physiotherapists who can come and help to people. Maija, now a Latvian reality, please.
Good morning. Do you hear me?
Yes, very well. Thank you.
Okay, it's so true that this is really busy time for us in the Center for Disease Prevention and Control, but at the same time, it's so refreshing to hear and speak about something beside the COVID-19. So thank you very much for inviting and thank you for organizing this Congress. So really briefly, I truly tried to put all information in few slides. It was quite challenging. But first of all, about our center, Center for Disease Prevention and Control, it's an institution subordinated to the Ministry of Health, and one of the main functions of our center is to coordinate the health promotion activities, not just in state level, but also in the regional level. And we inform public on very different issues related to health and healthy lifestyle. And we work mostly in these 4 directions, with annual budget 238,000 euros for all these directions and activities. So one of the directions we work is national level campaigns. We are organizing campaigns and informing about different, not just healthy lifestyle issues and awareness raising, but also we inform public about oncological disease prevention and spine and head injury prevention, about vaccination and different infectious disease prevention. We also coordinate and work with national networks in health promotion. We have 2 networks. One is the National Network of Healthy Municipalities. In this network are involved 113 municipalities of 119 of total municipalities in Latvia. So almost every municipality in Latvia is healthy. And the second network is National Network of Health Promoting Schools. This network is as a part of European health promoting school network, so only in this national level. In this network are involved more than 100 educational institutions, also kindergartens. We also every year try to develop new informative materials like videos, brochures, leaflets, infographics. Also, we are trying to cover all the topics related to disease prevention and healthy lifestyle promotion. So topics are many, but unfortunately, annual budget is one and for all topics, and unfortunately, the last years it has not been increasing; it has stayed the same. So and of course we try to organize different educational events in schools for adults, also in workplaces. For example, we educate children about personal hygiene and hand washing, what is especially important in this year. And other example, breast health and self-examination, educational events in school for older girls to make this habit for health examination. Here are some examples of informative materials related to movements, physical activities. And I mentioned this funding from state budget, from it was state financed. So the good news is that in this last years we have this European Social Fund program, growth and employment, according to what we can organize different health promotion activities, not just on national level, but also in local level. and one of the main areas in which these activities can be taken is physical activities. For example, here in some pictures you can see some training for adults and children. From this European Social Fund, there's a lot more finances available than our annual state budget. So we are really appreciating this opportunity to do these activities these years, and they will also will be available the next few years. So this is really briefly.
Thank you for being brief, but also very precise of how we organize this in Latvia. Unfortunately, not every municipality was involved in this. You showed us the two levels of responsibilities, but not everyone takes this responsibility and realizes, not always. Well, this is good, just good point to also discuss how to really organize it much better. Maybe, at least we have this stupid feeling. I'm kind of not happy of having this feeling in Latvia, but still we have it as a phenomena. That whatever is organized in Estonia is better organized. Hopefully, Kuuli Lukk will say that Latvians are always having this you know, too much of skepticism. Hopefully, you are better organized, Kuuli, in a sense that you can present this. So please, I just wanted to show to everyone how good friends are Latvians and Estonia. Estonians helped us to gain our independence 100 years ago. So we will be always thankful for you. So give us a good example how to defend and how to, you know, more achievements to be made together, hopefully. So please.
Thank you for kind words.
Oh, sorry, Kuuli, can you come closer to the microphone? Something is like, yes.
Yeah, is it better now?
It's much better. Yes, please.
Yeah.
Yes.
Okay. Thank you for kind words. My name is Kuuli and I work in a National Institute for Health Development. And unfortunately, I don't have a presentation, but I will show you one slide about our institute, and we'll let you know just with a small conclusion about our situation. So I share my screen now. I hope you all see it. Yes, great. I work in a National Institute for Health Development, and this is the most important institution in Estonia, which is dealing with health issues. And but sad true is that we have several institutions which are involved in the development of health promotion and health programs at the national level, and it makes the situation not so easy. Cooperation between this institution is rather fragmented than effective, especially this year. And some examples are in these fields. We have our institute, labor inspectorate, health board, and so on and so on. Yeah, and it is impossible for me to say how much funding is allocated to workplace health promotion, because different authorities are operating within their own budgets. And for example, in our institution, we have big programs, but for workplace health promotion, we have only same small amount per year for last 5 or 6 years. It is about 25,000 euros. And the sum is not much, but such a regular contribution helps to inform and maintain our programs and activities and achievements, and to train employers and the workforce a little. Me, myself, I am administrating a nice network. I can show you another slide, just a moment. This network is called Workplace Health Promotion Network. Just a moment. Sorry. I hope you see it.
Yes.
And it is created in year 2005, and now we have about 340 member organizations, and to become a member, it is not hard. It is very easy. You only have to send an application to us. And this network has great members who are making a good job in their with their workers. And what more? I would like to say that this year has been hard, but in national level we have a number of development strategies that address the issue of health, and unfortunately they do not involve always automatic additional funding. And responsible institutions raise additional money from various international programs, like in Latvia or in Poland, and also by cooperating with private companies. And we have also this tradition that administrative workforce is usually found within organizations, and often involves external partners. For example, me, I'm cooperating with several small private companies and hospitals and so on. Thank you.
Thank you. Thank you. So different countries has different systems. This is why I think it makes us even more to be involved in this building if it's needed. And that's actually the question I want to pass now to Jan de Maeseneer. He's once again the special advisor or the chair of this expert panel of effective ways of investing in health, which is panel for consulary for European Commission. Nevertheless, you work in Ghent University, and this is why I think it is very, let's say, right moment to ask, do we need to do a kind of European system? Because up until now, we are, union of independent countries, and one of the things is just new discussion in Europe. Should it be coordinated or realized even by European level? It was always a national level, and each can do it on its own and relying on its own budget. So now, when it comes to this European level, how to build this common system from the point of view of course, physiotherapist's role as a person, should we call him a key person or just one of the pieces of the puzzle, Jan, please? Jan? Oh, Jan, where are you? Okay. We probably asked this question during the panel then, and let us turn to panel when Jan. Aha, here you are. You probably didn't hear my question, Jan, or did you? Okay, so the idea is when we now talk about this European level, this is something new. So can I ask you, as the chair of this advising committee, how you think quickly we will be successful of doing a kind of common European approach, or should we do it at all? Maybe we should stay up until now into a national level, yes, with a good picture and bad picture, and actually it was more or less financed by the national governments themselves. So now when we go to this European level, surely the Eastern European countries are very keen to use any kind of resources and to get it from Brussels, but maybe we somehow diminish the previous achievements that were done by, let's say, Netherlands and Belgium you are living in. So maybe we should kind of do a different way how to get or not get at all. So from the point of view of scientists, please.
Yes, can I just, the answer is in my presentation. Can I just,
yes.
it's very short.
Absolutely.
Yes, let me do it that way. My apologies, I'm much involved in COVID nowadays, so I have to jump from the one to the other, but so happy that I am with you now.
And thank you for
I think that I'm sharing now my screen. Yes?
Yes, we see your
You see it?
screen.
Is it okay?
Yes.
Is it okay?
Yes.
Okay, so thank you very much. Thanks for this invitation. It's in 2 sentences. I find it very important because I think health promotion and prevention programs are extremely important. And the first work I ever did was research in health education and promotion. And second, it is about cooperation with physiotherapy. And I think physiotherapists have a key role in the health, in the cure, the care, the rehabilitation, but certainly also in the health promotion and the prevention. So I'm very much happy. And just to present you, the expert panel is a commission. Since 2013, I am the chair of, and we bring together experts in different fields from different backgrounds, not only clinicians, but also economists and health administrators and so on, to reflect on important topics. And as you can see, we are 17 people coming from different countries and backgrounds. And the idea is that we try to formulate documents, opinions based on the existing evidence. And generally, when we make an opinion, we summarize this evidence so that you have got a synthesis of what we know. And then secondly, to give advice based on our common thoughts or opinion in the way we could go forward. And so recently, 2 years ago, we published this opinion on options to foster health promoting health systems. And we try to describe, on the one hand, the evidence, but we came up also with some important ideas. What we proposed is that it was important to support sustained partnership for health promotion through the European networks and platforms among specialist agencies and national focal points. So bringing together the expertise is a very important thing. Also, do support research in health promotion. The development of innovative health promotion research should be much more supported in the EU framework programs for research, development and innovation. And also what we want to happen is that we can support also effective and sustainable multi-level partnerships across diverse sections and sectors to progress implementation of health in all policies, because I think that's also very important, and to meet the targets that are set by the Sustainable Development Goals. And finally, and most importantly, I think it's so important that we have to support at European level social mobilization strategies, so that there is an improved community engagement strategy to actively engage European citizens in creating a demand for health promotion in Europe and advocating for the implementation of policy decisions that impact on health and well-being. And I want to give you just one example, a grassroots example from the primary care, because it's not only the macro level, it should happen at the local level. And I just bring you through an experiment that we did with physiotherapists involved, not only in curative and rehabilitative interventions, but also in health promotion. And it happened in a community health center, which is an interdisciplinary group of providers, family doctors, nurses, psychologists, health promoters, physiotherapists, occupational therapists that work together and are responsible for local community. And so we try to integrate into that kind of health promotion activity. And a key role has been played by the physiotherapists. This community health center started in 2000. It's an interprofessional team. It delivers integrated primary care and social care. And it also tries to address the social determinants of health, because it's a neighborhood with a lot of social inequalities. And looking at those inequalities and looking at the health needs of the local population and the social determinants of health in the community, a health needs assessment was made, and it documented the high prevalence of locomotor problems like low back pain, chronic conditions like obesity, sleeping disorders, and higher cardiovascular risk factors for those at a younger age, such as smoking, hypertension, diabetes, and so on. Organized the interviews with the patients and the population was organized and revealed the need for accessible physical activity, the lack of green spaces for meeting each other, and the lack of all kinds of interaction in the community. So then the group used the community-oriented primary care strategy. And that's a strategy that starts from the definition of a community that identifies the community's health problems. And that was done with the interviews and with the assessment of data from the epidemiology. And then together with the local community, intervention was developed and monitored, and then looked at what were the outcomes were. And it's very important to use this kind of strategy. It's community-oriented primary care because it integrates individual-oriented approaches with population-oriented approaches. It integrates primary care and public health. And I think in order to make health promotion effective, we really need this integration. And so from this data, the group made a community diagnosis, not a diagnosis at the individual level, but at the community level, leading to a set of health promotion interventions. What they did, they designed a cardiovascular route in the neighborhood with increased spaces for meeting, like the neighborhood garden. The infrastructure for this route was made by volunteers and local social arts project. Secondly, the physiotherapists of the community health center developed the exercises that should be performed at different stops in the route. Feedback from participants suggested proposals for improvement. So it was an interactive kind of process. The people were referred to the cardiovascular route by healthcare providers, by social care workers, and by informal caregivers. And this project was coordinated by the health promoter of the community health center and supported by the local authorities, very importantly, of the city of Ghent. And so creating a healthier living environment through accessible infrastructure for improved physical activity really addresses the determinants of health and contributes to social cohesion, thereby reducing the social gradient in health. And there have been in the evaluation clear indicators of this outcome. And you see a picture of one of the different stops in this cardiovascular route. And what you learn from that is that there's a lot possible at local level. And therefore also we recommended that there should be much more knowledge translation also on concrete experiments at local level, creating learning, community learning networks at the European level also, so that this translation of knowledge mechanism for health promotion in the EU region could be developed through networks of dedicated health promotion knowledge centers to promote and improve the timely uptake and use of scientific research and knowledge to strengthen health promotion practices and policies. So we want really at European level, that was our advice, to really engage and invest in this kind of creation of learning communities with exchange between member states. And such networks could foster knowledge sharing, and provide a range of evidence-based tools, methods, and knowledge translation. And as you said, there are a lot of countries like the Netherlands, but also this kind of local experiments like we have from Belgian community health centers and other practices from Spain and France, and also what happens in Eastern European countries. Very interesting things happening in Poland. For instance, in Baltic states, I have visited the regions and seen also a lot of interesting experiments, so that by doing so, we can exchange practices and policy across member states with an emphasis on reducing health disparities. And I think that is what Europe should do and contribute to. So that was what we concluded from that. And I think another important issue that I want to mention is that if you look at the role of physiotherapists and other providers, there is really a need to think broader about what our tasks are. And health promotion is a task of every member of the primary care team. So we have written another opinion on task shifting and health system design, where we describe that there is really need of a strategy to make task shifting happen. And certainly when it comes to health promotion, when the message comes from different actors, from different disciplines to the same community, that will really reinforce that. And so we have to look at strategies to come up with change in mindset, change in culture, so that people are working together, that they are transgressing the limitations of the discipline that they are working in, and that they're trying to find a common ground. And I think that health promotion projects are an excellent way to build this kind of interprofessional cooperation, and also to engage in transversal task definition and task shifting within a team. And so that is more or less my message. And I think that primary care really is now at the crossroads of important societal changes, and that interprofessional teams also, when it comes to health promotion, can really make a difference. Thank you for your attention, and I'm open to all your questions.
Yes, of course, there will be questions and comments, and thank you actually for your great overview. Actually, can you imagine that so quick, in 1 hour, we were managed to see the nice overview of the whole continent actually. So this is why I think it was a great opportunity for all of us to be here. Now, let us turn to questions and answers, or actually the chat. And here I'd like Lina Pabo to come in the picture. Lina is also a very special person, in a sense that she's been involved, and she wanted to comment. Lina, you can now put on the microphone. You wanted to comment on role of physiotherapists in this post-COVID-19 situation. So please.
Thank you. Yes, Lina Pabo from the Estonian Association of Physiotherapists. Actually, I wanted to add a comment to Külli's presentation. Like she said, we have a great network of health promoting workplaces, also health promoting schools and health promoting kindergartens. But one initiative that I would really like to bring up is it's called Movement Promoting Schools. And it's an initiative with over 100 schools in Estonia and 47,000 students. So, and it's a great example of participatory health promotion as well, because the students and the teachers are involved in all the activities. And it includes active transport to school and from school, also active activities during classes and activities in between classes. So just to let you know that these kinds of things are also happening in Estonia that we are really, really proud of. Thanks. Okay,
so you've been mentioning a school, but then let's go deeper. I'm actually the father myself of four school children, And I was just thinking, by hearing your kind of, and there is this big question for discussion, the new probably role, or how to be better involved in this whole system of healthy lifestyle promotion. Should the physiotherapists come out from their offices, and should they have their, I don't know, 1 hour, 1 day, or 3 days, maybe part-time job in the school? I mean, we've got psychotherapists working in the school on a more or less everyday duty. Then we've got this social, the person who takes about like social issues in the school. Should your profession also has its own task, like parallel to the sports teacher? He does like different type of things, or that's enough? So Esther also has, yes, please, Esther, just come in discussion.
Thank you. I think that Lena has given a great example. And I think that the physiotherapists, and I've been working in this for many years, have a huge role in schools, particularly in the, the first primary, what we call primary school level. This comes back as well to the Ottawa Charter in terms of the settings. And we have health promoting schools. I think someone mentioned health promoting other areas, but there's health promoting schools throughout Europe. And my dream, I think, there's a physiotherapist in every village, in every town, in every city, in every country in Europe, is that even if you went back to your local school, that the role is not only for the children, but it's for empowering the teachers and empowering the community in which the school is set. And the things like Lena mentions, the walking to school, the getting up every hour and moving around, looking after the health and the empowerment of the teachers, so that they're also empowering that positive attitude in children, a positive attitude towards physical activity, so that they're setting really early. If we want to really improve population health, physiotherapists need to be in there in the national school. And in some places we are, in some countries we are. So as Lena has suggested, and I think it may be in Belgium as well, but this is a huge role for physiotherapists. So many of us are working in that area. We're not just in the workplaces, we're also in industry and ANSYS, working there as well in promoting health, but it's all a health promotion approach. Thank you.
Can someone comment? As a journalist, I'm usually involved as a moderator to these kind of also public events. And then it's once in a year, it's organized as a healthy lifestyle something. Should it be a festival? Should it be a 1 day or a public exercising? But then there is no this kind of strategy of a route. The Jan was giving this great, that there is an organized, let's say, a destination for, neighbors coming to this park, doing this, and then next park for next weekend. So there is no, there is always this 1 day we involve one physiotherapist who comes to our office, does this healthy promotion, talking, maybe exercising, but then people are somehow skipping. It's more or less the same story as we promised ourselves to start everything a healthy lifestyle from the 1st of January, and then at the 1st of February, we are in the same place where we were at the 1st of December now. So we always give these promises, we never keep them. So should you be the agent of like every good or big community really to keep up with your promises, to really being involved? So let me ask again, should you please come out from your offices, and do you have your good ideas how you will do it and where you will go? So school is just one and great and needed destination. What kind of destinations you could mention? Maybe Liva, since you have this red bottle and you've been organizing us around this table, probably also have your wish list.
Wish list. Wish list for physical activities for everyone. I think sometimes even the one day can give the message that we have to move. But I heard it during all of these discussions, and I heard it also yesterday when we started the Congress, that we have to talk, and we have to talk more and maybe more, and we have to work not only with the sentence be physically active, but we have to work on how do we can affect the behavior and change a bit the behavior and the thoughts about what is being physically active. And maybe this is the way that we all have to work together. That is one of the reasons of this discussion, that we can actually work together with the national organizations and like come out as a team to go to the society and tell them that we have a common opinion, and we actually can provide it here and there, and we connect the acute care with the everyday life, that we can like just bring the message together and work on that as well. I think that would be awesome.
Okay, thank you. So let us turn to Tim, and can I ask you precisely, should we like do percentages, Tim, that how much of your activity, I mean not each and other, but your profession should be involved in this active phase when you need rehabilitation after surgery or things like this, and how much of your presence as a physiotherapist should be in society at the very everyday level for a promotion of it. So until now in Latvia, I have this feeling that I would call or ask for a help of physiotherapist more when I am close to hospital or after hospital, or sometimes of course inside the hospital, that you are more people that I saw, at least in Latvia, that I would meet more or less in environment of clinic, not on a, in a park, in a school or somewhere. Should we somehow also change the mindset in this sense, please?
Oh, yeah, thank you. Well, it's very difficult to speak in percentages, but I can tell you that, for instance, for Belgium, that we are also just starting to get out of our offices, and that's just because the way the health system was organized here, and now we are actually doing more on the promotional aspects and getting out and being in the community. So that's very important. But it's just arising here, just like it's with you guys. But the thing I wanted to comment on is that I think that what we can learn from today is that it's not only necessary to push the button, but it's necessary to keep pushing the button, because like you said, doing an activity or organizing a festival, you get lots of enthusiastic people, and they are very keen to join, and they make promises, but it's the follow-up, and I think that that's the important thing. And I know from a European perspective that changing a framework is more difficult than implementing something new. So once something is established, and you get a good health promotion and a participation of the people, then it kind of runs smoothly. But it's so difficult to get a system, a change in a system. And I think there's the collaboration. I think that's very important. And like Thierry highlighted it, I think that it's very important that we as physiotherapists seek collaboration with other healthcare professionals. It's so important to have a collaboration with the patients, of course, and even before they turn patients, healthcare promotion is also for healthy people. Keep them active and healthy before they become patients, and I think that's the most important thing. But I really agree with what you say. There should be, again, sticking a percentage on it, it's not easy, but there should be a great percentage of our work should be allocated to the health promotion and not only to disease, the curing of disease. Thank you.
Okay, thank you. And then Monica and well, Dalia comes in the picture. So Monica, we start with you, please.
Good morning, everyone. Yes, I'm Monica. I'm from Poland. I'm a physical therapist, and I'm also chair of the physio prevention programs and unit in our chamber. And first of all, I would like to thanks a lot for all this information and knowledge sharing, because I pick up some sentences and would like to comment, because Esther said that if there is no compliance, this is our problem as a physiotherapist. So this might be a first tackle to overcome, because as a physiotherapist, for example, in Poland, we thought about being in schools, yes, bringing physiotherapists to schools. But then there comes the intersectional relationship and intersectional community, because in Poland we have a law that there is a nurse in school who is, let's say, leading medical aspects, yes? So we have to cooperate in terms of diagnosis, in terms of, for example, picking up the children with some posture disorders, yes? Maybe this is a link to be more effective. And I also take the sentence that from Thierry, that physiotherapists should be lifestyle coaches. Exactly. And it is not only the issue that should be bring to schools, but to the teachers. As Livia said, there was also some actions dedicated to ergonomy for adults, yes. So there is a huge area to cooperate and to make us more visible as medical experts, I think, as health-related people who can have, or who has the knowledge and have a really good attitude to do it. So just like to comment, thank you.
Okay, but then can I ask you, then it seems like you are ready, that your your profession becomes more and more as a host for groups, for this group activities. So not the physiotherapist who is like giving a special advice to special, I don't know, the patient or someone, but up until now, I have this feeling that your profession was more on a private level. There is a patient or someone who wants to talk to you, and then there is one specialist. So it's two persons in the cabinet at the same time. Or I'm wrong? I'm just living in Latvia and seeing it a very small piece of puzzle of it.
It usually works like a person-to-person relation, but when you are talking about the person who is ill, but our role is also to educate and to make the change in the whole perspective. For example, I am let's say an expert for football, yes, and my role as a physiotherapist is to bring the knowledge about the warm-up, the specific tasks for kids, yes, how to move well. For example, I think that as a physiotherapist, we have a good background for the kids' development, yes? And as a physiotherapist, we can see whether they develop well. And for example, if we are not a part of the health system, it may be a gap between, for example, 1-2 years old child and then 6-7 years old child who is, for example, in the school, and we miss a whole spectrum of potential intervention for physiotherapists.
Okay, Dalia, I want to ask you the kind of your comment, of course, you wanted to raise, but also a little bit of maybe misunderstanding, at least for us, for a greater society, of there is a kind of rocket science when it goes to, let's say, rehabilitation. And then there is a science. This is a professor. He's especially trained medical stuff. And then up until now, it seems like physiotherapists are not treated in the same level of society. Should this also be changed? Since I understand you work as a teacher as well, so it means you probably see this difference and how this is changing. At least in Latvia, of course, we have both departments, but they are still two and different ones in local medical schools. So in universities, maybe sometimes we miss these two professions, or should mix these two professions, and should we still keep mixing them, or actually merging together, because more or less you use more or less the same equipment sometimes when you speak to your possible clients.
Yes, thank you, Ansis. This is really the issue, and this is the barrier to promote exactly what is physiotherapy, who we are, what we do, because there is a misunderstanding of society, rehabilitation, physiotherapy, rehabilitation doctor, who is it, where we are. Of course, this is very confusing. But this is really a huge topic, maybe for another second Baltic Congress. We have in Poland, of course, there's a physiotherapy, and we are also the academic teachers as a physiotherapists. But then again, there's still the rehabilitation medical doctors. But this is something different. Those are different scopes, but I understand this is misunderstanding for the society. But I would like to comment on the what Tim said. Of course, there's a we need to thinking systematically, or thinking that the system need to change, and we need to be aware that there's also patient awareness. And we should motivate patients to change their behavior. I mean, we could, of course, provide specific health promotion programs, promotion of healthy lifestyle, but when the patient is not keen to change, then it's hard to discuss with him. So we also need to think about what we call patient self-management, that we should shift the tasks from the professionalist to a patient. So it's his or she's role to change the behavior and to stay fit or to promote something. And we are just as educators, as motivators, but we cannot do it when the patient is not involved. So the patient self-management is a really key thing here. We have, for example, so the patient needs to know the responsibility of his or she's about their health. Because, for example, in Poland, the tradition of physiotherapy, let's say 20 years back, was that someone come to physiotherapist and he wants, or she, the patient wants to be cured, and that's all. He lay down and just waits to I don't know, miracles happens. Yeah, but of course this approach is wrong. So we need to educate patients that this is their responsibility for their health. So we are there to educate, to help to help them in a changing behavior, but their self-management about their health is really the most important key. So they need to do it themselves. Thank you.
Okay, Dalia, and then my last wish is, could you give us a very short exercise of what we should do now, just to refresh ourselves before we quickly turn to Thierry. And Thierry, you should also now think about the second exercise. This will be your entrance ticket, okay? So Dalia, what we should do now, very quick one, like 10 seconds. Thierry was showing this. Okay, Thierry, you will be reminding us when your turn comes in the comments to Dalia's okay.
Something, you know, something maybe more. No, it's not enough. Yes, Esther is jumping.
Esther, thank you. Okay.
Also, this YMCA exercises.
Oh, right.
Conferences. Of course, just rise up, do the push-ups, and then come back.
Okay, thank you very much. So now we turn to Thierry. Should you show us something? And you also wanted to comment, but before you comment, show us exercise.
Yeah, I will give you my best exercise, or my favorite one. Since I have a wall right here, I can show you. It's called diamond. I think all the physios know it very well. So you go up here and you push it all the way back. So you make like a diamond shape. For all of you who don't have the wall, then you know, don't worry about it. You can try it later. So hi everyone, I haven't spoken today yet. My name is Thierry and I'm from Estonian Association as well. And I don't want to be a party pooper. I'm actually a very positive person, but I would like to raise those barriers, or at least maybe give you the main issues we have in Estonia, why all these nice ideas somehow still need a lot of energy to put it in. For example, we are living in the constant shortage of personnel. We have barely enough physios for really critical care. Or not really critical, but let's say if someone has a condition already, some kind of trauma or some other illness, then we have in a healthcare centers and hospitals, we have physios. So there's no one waiting for some other work and just sitting around. And actually the question is here, where does the money comes? Who pays for that kind of services, that kind of physio, where you only give the advice when you don't make the painful joint less painful, when you give advice about lifestyle? Who pays for that? Is the National Security Fund really able to do that, or does it have to be national, public money, or should it be from somewhere else? And the other thing I was thinking is our education. This 3 years education, we in Estonia is the main level or the first level. They don't teach our physios about health promotion. Maybe a little bit, maybe somewhere, but there's a lot of attention on really serious conditions like cardiovascular, neuro, everything like that. So very often I listen some colleagues telling that she is healthy, I don't know what to do with her. You know, so we are not educated to work with healthy people, let's say that way. So if you could comment on that, how to get over these barriers. Yeah, Esther-Mary probably knows very well how to get
come in the picture. And can I also add to this what Thierry raised, just maybe one more aspect of your comment? So there is Inga, she's in Belgium, I understand. Sorry. Inga is in Lithuania, I guess. So she was just saying that there is this lack of understanding of what is the difference of a coach and sport instructor in the fitness club by really your profession. So where should we draw the line, or should never draw the lines, just merge these lines? So maybe also this type of a comment is needed, please. Yeah, put on the mic, please, Esther.
Thank you. There's a few issues that have come up that I'd like to address, I suppose, in a European perspective, if I may, just taking some points. One is there was issues around kind of rehabilitation doctors and what's the difference. So I just need to paint the picture that in Europe that's not the case. For instance, in my country we have no rehabilitation doctors. Okay, in the UK there would be no rehabilitation doctors. So the physiotherapist would be the first contact practitioner. You would go to the physiotherapist for either lifestyle or for treatment. I think with regard to Thierry's issue about the money, I can't talk specifically about funding, but I think that we have to think in terms of two things. We have to get the whole away from education and into empowerment, and that needs to be in the curriculum of every physiotherapy school. So we must be in the schools showing and teaching these brief intervention skills so that every physiotherapist has that in their repertoire in terms of empowering the patient. And therefore they need to make every contact count. So we see all of these patients whom we treat, we are using that opportunity as we are treating them to empower them in terms of taking up the lifestyle. And I think there's one question in your chat box to me about this, and if I could just take it on a very local idea, is, you know, you're treating someone for a condition, fractured arm, you know, post-fracture, whatever, and they make a comment like, oh yeah, you know, I know I'm a bit overweight, but I'm not quite sure what to do about it. As physiotherapists, we must never lose that opportunity. So we must be listening all the time. We must pick that up. That patient is, you know, is in a kind of contemplation or pre-contemplation stage, and we've got to target what we do. So we open up that discussion a little bit. Now, we're not dietitians, but we can point the patient in the direction. We can make the appointment for the dietitian. We can bring the dietitian in. We can talk a little bit about physical activity. It's not just educating them, it's empowering them so that when they come back the next time, you develop that conversation a little bit more. It's not just going in for an hour and doing an hour's physical activity with a school or with a workplace and coming out. As you rightly pointed out, Ansis, this change needs to be sustainable. So we need to keep working with it. So get it into the schools, get the empowerment into the schools, into the physiotherapy schools, get the physiotherapists working in that with every contact they make, and get them into the health promotion settings, the schools, the workplaces, not to do an hour's physical activity, but to work on that whole empowerment of the teachers, the community, and the school children.
But do you have this feeling, like at least I have this feeling that there is still fight to be needed, maybe not in every country, I don't know, but your profession should be involved into this interdisciplinary, let's call it the situation when the one patient is sent in between different, be it dietologist, be it physiotherapist, but he's always has to go with his medical document to this and that and there, and he never meets you in one place like three specialists together. Maybe this is where you lose that patient at one point, because he's somehow scared. Should I now go to dietologist? Wow, it seems a little bit weird. Okay, should I now go there? And then he never goes. He never makes these steps, because if I do just one visit to interdisciplinary, let's call it committee of specialists who are treating me at these 20 minutes or 2 hours, whatever. But I have this feeling that you send them to dietologists send them to physiotherapists, and then at the end there are too many cabinets and too many payments at the end, which also somehow scares people really to take it serious.
Okay.
To take this interdisciplinary idea.
Yeah, if I could just come back on that, and I think that's a great idea, but that is one of the reasons why in our National Health Service and in the UK as well, where it's not private and they're not paying for it, but that no matter who they go to, so if they happen to be going to a physiotherapist for, you know, post-surgery, or they're going to a dietitian for reason, whatever, the message is actually the same. The empowerment message is the same. And that's how my country decided that would have the greatest effect. So every health and social care professional is obliged to actually deal with this, with whatever patient they're treating or whatever condition they're treating, is to take up this whole lifestyle issue and empowerment to decrease risk and increase health behavior. So regardless of who they go to, they're getting the same empowerment, the same message across the health service.
Okay, Thierry, you wanted to come in a picture with your comment actually much earlier, but sorry, I didn't give you opportunity. So please, which point you wanted to react for?
No problem, thank you. Thank you for the discussion. And I think one of the important things that I'm hearing throughout all of the countries in Europe is that the important thing is that we facilitate, as physiotherapists, we contribute to facilitating the behavior change which is needed to sustain the lifestyle changes, to get a healthy food intake, healthy physical activity, and the behavior change. We need to start at a young age, but we also need to tackle the adult population to prevent them from getting chronic, non-communicable chronic diseases. So at every level, at every age, we have to do something. And what we try to do here in the Netherlands is the combined lifestyle intervention is sort of like a step in that, and we shift the boundaries of physical therapy a little bit towards lifestyle, but there is space for everybody. There is so much need for healthcare that we have physical therapists who specialize in certain conditions like orthopedic, rehabilitation, and everything else. But we also have physical therapists who specialize more in the lifestyle area. They work with municipalities, they work with neighborhood sport coaches, and you really have to get that connection going and get the flow of the patient towards the regular sporting or physical activity seamlessly for them to be able to sustain to get into the healthy habits, as it were.
Okay, now who else wants to raise the question, or maybe a good, precise, and is it an easy answer actually to give to this kind of overall question of discussion? How can we effectively involve physiotherapists in health promotion activities? Does anyone has more ideas? I heard schools. I heard more of this interoperability with colleagues from other professions. I heard it more of promotion of talking to healthy people, not only to the people who are already patients. When there is what else I didn't mention? Maybe there is something that we are lacking from the list of things to do in your profession in the next few years, please.
And can I just make one suggestion? I'm sorry, I don't want to go hog it, but I came across a wonderful example in Norway where the physiotherapists sit on the planning boards of the municipality in order to help with the design, where there's actually, rather than having everything right beside you, that there's walking involved. And, it might not be the best thing to have your car right beside your house, where indeed if the car park was further away, there's more movement involved. So I think that's a fantastic idea. I would just love to see that spread a bit more, but to see physiotherapists in there influencing planning that facilitates greater movement and greater activity among residents in cities and urban planning and in rural planning is fantastic. So just another idea.
Well, actually, COVID-19 also gives this idea, because some people don't use public transport anymore. They use more and more bikes. And thank you for those who live in the Netherlands. We use your secondhand bikes a lot this season. We buy it, and they became even a deficit. And the price was rocketing. People really turned. And many new passages were even built in the roads at least the Riga city. So there are good news of COVID and the movement. Hopefully it will become tradition after this terrible disease will be gone from our reality, so that the movement reality, the idea of healthy lifestyle will stay as a consequence. Now, any new ideas how to do these promotion of a physiotherapist's role? How to go? Let's copy paste good examples from Netherlands. And yes, Dalia, please.
Yes, thank you. I would like to raise a discussion, or maybe just to sum up what we talked about. Of course, physiotherapy is the prevention or promotion of health, and prevention, it is a physiotherapy. I mean, we have 3 phases of the prevention. And when we are talking of the primary promotion, so there are people who are healthy and who want to change the behavior. Of course, it's obvious that we could educate them, and we need to do this. But when it comes to the secondary prevention, so we are dealing with sick people, with diseases. Yes, this is not so easy. I mean, from the Polish perspective, for example, because this is already something medical. I mean, there's a disease, there's a patient, and this is considered as a medical, of course, service. And since we are now regulated as a profession, and we are independent, like medical profession, it is easier, but it wasn't like that just a few years before. But what I want to add, this is the importance is the regulative approach. I mean, the profession should be regulated. This is from our experience as from the chamber. So if we regulate the profession, if we state the exact scopes of practice, that we formulate the prevention and health promotion skills that we have, it would be easier to use those arguments for policymakers, and of course it will increase the quality of service and as well the patient safety. So because in Poland we have this thinking, I mean the policymakers, in the health ministry, the stakeholders, that okay, when it's about promoting healthy habits, well, nowadays everybody wants to say something in this topic. Yes, and we don't have to be exact, I don't know, professions about it. This is what they are thinking, but it's other way when you are talking about this sick people, the diseases. Then there's the argument that are we really the specialist who could coordinate it, who could do this prevention programs? Yes, so this was the really big issue in Poland, and since we regulated the profession, it's far more easier to promote our contribution to this preventive programs, to this preventive education. That is what I want to say. Thank you.
Thank you very much. And now it's 12 o'clock in Latvia. I hear my neighboring church ringing the bells, but in the same time, I very much appreciate the Ghent, one of the nicest towns in Belgium, if not in Europe. So this is why Jan will have to sum up and maybe to raise some questions for further discussions amongst us in a smaller community or just for next meeting. So Jan, as a scientist and as someone who will be probably taking some points to this European Commission level, where you are advisor. So what kind of conclusions you could draw from these 2 hours, please?
Thank you very much. First of all, this was very inspiring, and it is really a positive sign that a profession like physiotherapy is really committing themselves to health as a general objective. And I think that that's a very important thing. What we learned also from COVID in all the countries is that this segregation between public health and primary care doesn't work. At the community level, we have to integrate that, because we have to do both promotion. We have to both look at the individual and at the population. And we had to do that continuously during the COVID-19. And I think that should make us reflect. And of course, that means that we need interprofessional teams. And that means also that we have to share information. An integrated electronic record is so important, where also the patient has access to, in order to stimulate cooperation, so that really you can see the whole picture, and that stimulates also all this issue of integrated care, which I think we should absolutely go for. And in order to stimulate that, I think that also integrated payment systems are very important. In the Belgian system, the team of physiotherapists, family physician, nurse, assistant nurse, and health promoter, they are paid with an integrated capitation according to the needs of the population. And that means that you have to work together because you have a common financial incentive. And I think these are all things that can stimulate this kind of cooperation. And then I think that what second mission and message I learned from this is health promotion is really a key task for the physiotherapists at community level. And there are lots of opportunities. Already for 10 years in our community health center, we organize cycling courses for the people from Africa, the migrants arriving in the community. It's too expensive for them to use public transport. And so they all want to cycle. We learned them cycling. So it has a concrete need, being more mobile, and there is a solution that's helpful for their health. So this kind. We also, and that's the other thing, the one-shot issues are problematic. So that's why we organized that with the whole community. We decide to walk from the city of Ghent to Riga, which is more or less 2,800 kilometers. And we did that during 1 year. So all kinds of activities where groups in the community were doing this distance all together. And the other thing is this kind of activities, like also the cardiovascular route I illustrated you, it is not only good for the physical condition, it's very important for mental health. What you do is you build social cohesion between people. And of course, social cohesion is what our society needs most today in order to be able to build projects for the future. And we should never forget about that. I think also the role of physiotherapists towards the school, I think there it's an issue of advocacy, putting the accent on the importance of movement and infrastructure, and also training the teachers so that they can integrate in their teaching activities, physical activities. And now we have to open the windows for COVID, but let's also do some other kind of exercises by time and while. I think it's important. And then finally, most importantly, and I go back to an experience we had already in the previous century when we saw in our consultations, in our individual consultations, that the physical condition of our youngsters was so bad. We did the survey and we saw that they were looking at computer games, video games, and all the time. And the diagnosis in the community was very simple. There was a lack of green spaces. There were no green spaces. We live with 10,000 people on 1 square kilometer. So the prescription was not vitamins or physiotherapy. It was another infrastructure, building playgrounds. And that made a difference. We built 7 playgrounds and you saw immediately an impact of that. And so the physiotherapist, as the example that was given by Esther-Mary, also has to sit there because he's got the expertise. And the important thing to close the circle, when you invest in integration of primary care and public health, with the trust you build in your primary care encounters when people are in need and you help them as a physiotherapist and you bring them a step further, and that builds trust. That trust is the basis of your health promotion activity when you have to address to your community messages for improvement of health. And let's not forget in all our approaches to look also at the most vulnerable people. We know that the physical condition of the poorest people in society, of the most vulnerable groups, that's the worst one. And so we can really make a difference and bringing those people, also integrating them in your activities, they will feel more rewarded for the person they are, and they will increase their self-confidence. And I think all these effects are so needed in society today, certainly when it comes to our collective mental health, that has been affected severely by COVID-19. And I think in Europe, we want really to create the possibility to have this kind of exchange and to learn from each other so that we can take advantage of the expertise and translate that to our communities and to our contexts. So that was more or less a kind of learning from all your very relevant inputs that I've got.
And thank you, Jan. I know that next Sunday there is San Nicola coming in your country. This is a very special tradition in Belgium. So of what you said at the very final phase, this social aspect of your profession should be more promoted and you should have this heart in the right place. I think it very much gave to me at least this San Nicola or Christmas feeling. So Jan, from my side, from Latvian Chocolate Factory, I'm sure that in your booths next morning at the 6th of, no, it's like Sunday morning, right? At the 6th of December, you will receive full of Latvian chocolate sent by Liva probably, or me. Let's discuss it later. But nevertheless, thank you for this. And hopefully we still believe in our professions and in San Nicolas and in Christmas situations. And this will be different Christmas anyway. Yeah? Total lockdown in Latvia. Maybe some countries will manage get out from lockdowns. But when you will get out and we will get out, we will need each other, like hopefully not patients, but more of healthy lifestyle seekers, the persons who will look forward to your suggestions and to your tasks you will give us for even better improving our healthy lifestyles, your profession is needed. This is my good conclusion, and you will have a lot of things to do. So congratulations for your next years to come as well. So thank you.